Thank you for your purchase of Wexler's minimally invasive surgical instrument. In this video, we are going to show you how to properly handle and maintain our MIS instruments for optimal use. Pick up and hold the instrument similarly to how you would hold a pencil. Your index finger should be on the top handle, and your thumb will be on the bottom handle. It should fit comfortably in your hand without slipping or pinching. Our MIS instruments are available with locking and non-locking handles. The locking mechanism works best with light to medium pressure. If the handle is squeezed too tightly, the locking mechanism will not catch. Our new MIS design features a low-profile, built-in flush port for easy, no-hassle cleaning. When it is time to clean the instrument, attach the syringe to clean the internal components of the instrument. If you are using one of our previous models, simply attach the flush port adapter that came with your instrument. These are also available for purchase if you need a replacement. After cleaning the instrument, lubricate the joints with a steam-permeable, water-soluble instrument lubricant prior to sterilization. This will prevent sticking and help to ensure your instrument continues to perform at optimal levels. After sterilization, we recommend that instruments be stored in a clean, dry area with tip protectors. Please examine each instrument for wear and tear prior to use for functionality and damage. For more detailed sterilization instructions, please review our IFU and the Mix Maintenance Guide.